41. A nurse is caring for a patient with dissociative identity disorder. What is the priority intervention? A. Encourage the patient to recall traumatic memories. B. Establish trust and safety. C. Ask the patient to ignore alternate personalities. D. Confront the patient about inconsistencies in their story. Answer. B. Establish trust and safety. Rationale. Safety and trust building are essential before addressing trauma in dissociative disorders. 42. A patient taking lithium reports severe diarrhea and tremors. What should the nurse do first? A. Reassure the patient these are normal side effects. B. Give an antidiarrheal medication. C. Check lithium levels immediately. D. Increase the patient's fluid intake. Answer. C. Check lithium levels immediately. Rationale. These are signs of lithium toxicity, requiring urgent assessment. 43. Which behavior is most characteristic of narcissistic personality disorder? A. Intense fear of abandonment. B. Grandiose sense of self-importance. C. Unstable mood swings. D. Preoccupation with order and perfection. Answer. B. Grandiose sense of self-importance. Rationale. Narcissistic personality disorder is characterized by arrogance and an inflated sense of self-worth. 44. A nurse is teaching a patient with panic disorder. What is the best initial intervention during an attack? A. Encourage deep breathing. B. Tell the patient to calm down. C. Ask the patient to discuss their fears. D. Explain the long-term effects of anxiety. Answer. A. Encourage deep breathing. Rationale. Deep breathing helps regulate the autonomic response and reduce panic symptoms. 45. Which neurotransmitter imbalance is associated with schizophrenia? A. Increased serotonin. B. Decreased dopamine. C. Increased dopamine. D. Decreased norepinephrine. Answer. C. Increased dopamine. Rationale. Excess dopamine is linked to schizophrenia symptoms. 46. A patient with major depressive disorder starts taking an SSRI. When is the highest risk for suicide? A. Immediately after starting the medication. B. 1 to 2 weeks after starting the medication. C. 3 to 6 months into treatment. D. After full remission. Answer. B. 1 to 2 weeks after starting the medication. Rationale. Energy levels improve before mood does, increasing suicide risk. 47. A patient with bipolar disorder is prescribed lithium. What should be included in patient education? A. Limit fluid intake. B. Avoid excessive sodium intake. C. Take the medication only during manic episodes. D. You will need frequent blood tests. Answer. D. You will need frequent blood tests. Rationale. Lithium requires regular monitoring to prevent toxicity. 48. A nurse is caring for a patient with PTSD. Which therapy is most effective? A. Exposure therapy. B. Psychoanalysis. C. Hypnotherapy. D. Psychodynamic therapy. Answer. A. Exposure therapy. Rationale. Exposure therapy helps patients process and reduce trauma-related distress. 49. Which symptom is most indicative of opioid withdrawal? A. Respiratory depression. B. Increased heart rate and sweating. C. Pinpoint pupils. D. Decreased bowel sounds. Answer. B. Increased heart rate and sweating. Rationale. Opioid withdrawal includes autonomic hyperactivity, e.g., tachycardia, sweating. 50. A nurse is assessing a patient with anorexia nervosa. What is an expected lab finding? A. Hyperkalemia. B. Hypocalcemia. C. Hypokalemia. D. Hypernatremia. Answer. C. Hypokalemia. Rationale. Starvation and purging lead to low potassium levels. 51. A patient is experiencing akathisia due to an antipsychotic. What is the best intervention? A. Lower the antipsychotic dose. B. Administer a beta blocker. C. Increase the antipsychotic dose. D. Encourage relaxation techniques. Answer. B. Administer a beta blocker. Rationale: beta blockers like propranolol can help relieve akathisia. 52. A nurse is caring for a patient with paranoid schizophrenia. Which response is most therapeutic? A. I don't see anyone watching you. B. You're imagining things again. C. That must be scary. You're safe here. D. Let's not talk about that right now. Answer: C. That must be scary. You are safe here. Rationale: validating emotions while providing reassurance is therapeutic. 53. Which patient statement suggests obsessive-compulsive disorder? A. I hear voices telling me to do things. B. I have to check my door lock 10 times before sleeping. C. I feel hopeless all the time. D. I avoid social gatherings because of anxiety. Answer: B. I have to check my door lock 10 times before sleeping. Rationale: repetitive, compulsive behaviors are characteristic of OCD. 54. A nurse is caring for a patient in alcohol withdrawal. What is the priority assessment? A. Depression symptoms. B. Blood pressure and heart rate. C. Level of motivation for sobriety. D. Suicidal ideation. Answer: B. Blood pressure and heart rate. Rationale: alcohol withdrawal can cause life-threatening hypertension and tachycardia. 55. A patient with borderline personality disorder engages in self-harm. What is the priority nursing intervention? A. Set firm limits on behavior. B. Teach emotion regulation skills. C. Encourage the patient to talk about childhood trauma. D. Provide constant supervision. Answer: D. Provide constant supervision. Rationale: immediate safety is the priority in self-harm cases. 56. Which finding suggests neuroleptic malignant syndrome, NMS? A. Muscle rigidity, high fever, confusion. B. Hypotension, sedation, dry mouth. C. Tremors, restlessness, tachycardia. D. Hallucinations, paranoia, sweating. Answer: A. Muscle rigidity, high fever, confusion. Rationale: NMS is a life-threatening reaction to antipsychotics requiring emergency intervention. 57. A patient with generalized anxiety disorder is prescribed buspirone. What should the nurse include in teaching? A. This medication works immediately. B. Avoid alcohol while taking this medication. C. Take this medication as needed for anxiety. D. You will need routine blood tests. Answer: B. Avoid alcohol while taking this medication. Rationale: buspirone should not be taken with alcohol, but it does not require routine blood tests. 58. A nurse is assessing a patient with ADHD. Which symptom is most characteristic? A. Hallucinations. B. Distractibility and impulsivity. C. Poor appetite. D. Excessive sleeping. Answer: B. Distractibility and impulsivity. Rationale: ADHD is marked by inattention, hyperactivity, and impulsivity. 59. A patient states, I want to die, but I have no plan. What is the best nursing intervention? A. Place the patient in seclusion. B. Ask about protective factors. C. Ignore the statement since there is no plan. D. Give the patient privacy. Answer: B. Ask about protective factors. Rationale: assessing protective factors, e.g., support system, reasons for living, helps determine risk level. 60. A patient experiencing a manic episode is pacing the unit and talking loudly. What is the priority intervention? A. Offer a quiet environment. B. Tell the patient to stop pacing. C. Allow the patient to pace uninterrupted. D. Provide a detailed explanation of their behavior. Answer: A. Offer a quiet environment. Rationale: a calm, low-stimulation environment helps de-escalate mania. 61. A nurse is caring for a patient with major depressive disorder. Which intervention is most appropriate? A. Encourage isolation to promote rest. B. Allow the patient to stay in bed all day. C. Encourage participation in simple activities. D. Provide frequent snacks instead of meals. Answer: C. Encourage participation in simple activities. Rationale: engaging in small activities can help improve mood and prevent withdrawal. 62. Which medication is most commonly used to treat alcohol withdrawal? A. Haloperidol. B. Lorazepam. C. Lithium. D. Fluoxetine. Answer: B. Lorazepam. Rationale: benzodiazepines like lorazepam help prevent seizures and agitation in alcohol withdrawal. 63. A patient with schizophrenia refuses to take medication, stating, "The government is trying to poison me." What is the nurse's best response? A. That's not true. You need to take your medicine. B. I understand that you're scared, but the medication will help you feel better. C. If you don't take this, you will be restrained. D. Let's not talk about that right now. Answer: B. I understand that you're scared, but the medication will help you feel better. Rationale: acknowledging fear while gently encouraging treatment promotes trust. 64. Which food should a patient avoid when taking an MAOI? A. Bananas. B. Chicken. C. Cheese. D. Rice. Answer: C. Cheese. Rationale: MAOIs interact with tyramine-rich foods like aged cheese, causing hypertensive crisis. 65. A nurse is teaching a patient about fluoxetine. Which statement indicates understanding? A. I can stop taking this medication once I feel better. B. I should avoid alcohol while taking this medication. C. This medication may cause high blood pressure. D. I will take this medication at night to help me sleep. Answer: B. I should avoid alcohol while taking this medication. Rationale: alcohol can increase side effects and should be avoided. 66. A patient with antisocial personality disorder is manipulative. What is the best nursing approach? A. Set firm, consistent limits. B. Allow the patient to have their way to avoid conflict. C. Avoid discussing consequences of behavior. D. Offer special privileges for good behavior. Answer: A. Set firm, consistent limits. Rationale: clear boundaries prevent manipulation and reinforce appropriate behavior. 67. A patient with PTSD is experiencing a flashback. What should the nurse do first? A. Encourage the patient to describe the trauma in detail. B. Remind the patient they are in a safe place. C. Ask the patient to stop the flashback. D. Leave the patient alone to calm down. Answer: B. Remind the patient they are in a safe place. Rationale: grounding techniques help reorient the patient to reality. 68. Which symptom is most indicative of serotonin syndrome? A. Hyperreflexia and fever. B. Constipation and bradycardia. C. Hypotension and confusion. D. Dry mouth and urinary retention. Answer: A. Hyperreflexia and fever. Rationale: serotonin syndrome presents with neuromuscular and autonomic instability. 69. A nurse is assessing a patient with opioid intoxication. Which finding is expected? A. Dilated pupils. B. Hypertension. C. Respiratory depression. D. Agitation. Answer: C. Respiratory depression. Rationale: opioids depress the central nervous system, leading to slow breathing. 70. Which medication is used to reverse benzodiazepine overdose? A. Naloxone. B. Flumazenol. C. Methadone. D. Haloperidol. Answer: B. Flumazenol. Rationale: flumazenol is a benzodiazepine antagonist. 71. A nurse is caring for a patient with anorexia nervosa. Which intervention is a priority? A. Allow the patient to exercise to reduce anxiety. B. Weigh the patient daily after meals. C. Supervise the patient during and after meals. D. Let the patient choose their meal portions. Answer: C. Supervise the patient during and after meals. Rationale: monitoring prevents purging behaviors. 72. A patient with schizophrenia is experiencing command hallucinations. What is the priority action? A. Ask what the voices are saying. B. Tell the patient to ignore the voices. C. Provide a distraction like music. D. Encourage the patient to rest. Answer. A. Ask what the voices are saying. Rationale. Assessing hallucinations helps determine risk, e.g., self-harm or harm to others. 73. Which side effect should a nurse monitor for in a patient taking clozapine? A. Hypertension. B. Agranulocytosis. C. Weight loss. D. Insomnia. Answer. B. Agranulocytosis. Rationale. Clozapine can cause life-threatening decreases in white blood cells. 74. A patient with bipolar disorder is prescribed valproate. What labs should the nurse monitor? A. Liver function tests. B. Platelet count. C. Electrolytes. D. Blood glucose. Answer. A. Liver function tests. Rationale. Valproate can cause hepatotoxicity. 75. A nurse is caring for a patient with OCD who washes their hands repeatedly. What is the best intervention? A. Allow unlimited hand washing to reduce anxiety. B. Interrupt the behavior and redirect immediately. C. Encourage gradual time limits on hand washing. D. Ignore the behavior. Answer. C. Encourage gradual time limits on hand washing. Rationale. Gradual exposure helps reduce compulsions. 76. A patient with borderline personality disorder frequently threatens self-harm. What is the best approach? A. Ignore the threats to discourage attention-seeking. B. Provide one-on-one supervision when threats occur. C. Give positive reinforcement for threats. D. Allow the patient to discuss self-harm freely. Answer. B. Provide one-on-one supervision when threats occur. Rationale. Ensuring safety is the priority. 77. A nurse is caring for a patient with alcohol use disorder. Which statement suggests readiness for change? A. I can stop drinking anytime I want. B. I drink because my life is stressful. C. I want to stop drinking, but I don't think I can. D. I need help to stop drinking. Answer. D. I need help to stop drinking. Rationale. Acknowledging the need for help indicates readiness for change. 78. A nurse is assessing a patient with opioid withdrawal. Which symptom is expected? A. Bradycardia. B. Severe hypertension. C. Muscle aches and yawning. D. Respiratory depression. Answer. C. Muscle aches and yawning. Rationale. Opioid withdrawal includes flu-like symptoms. 79. A nurse is teaching a patient about buspirone. Which statement requires further teaching? A. I will take this medication daily for anxiety. B. I can take this medication as needed. C. This medication does not cause dependence. D. It may take a few weeks to start working. Answer. B. I can take this medication as needed. Rationale. Buspirone is not a PRN medication. It requires consistent use. 80. A patient with schizophrenia believes the FBI is following them. What is the most therapeutic response? A. You are imagining things. That's not true. B. It sounds like you feel unsafe. Tell me more. C. The FBI is not interested in you. D. Don't worry. You are safe in the hospital. Answer. B. It sounds like you feel unsafe. Tell me more. Rationale. Acknowledging feelings while not reinforcing the delusion is therapeutic.